So there will be a recording of this presentation available after today. Let's see you, Ms. Kelly. Thank you for joining us. My name is Brent Stubbs. I am the Vice President for Economic Development at Savannah Technical College, which encompasses our continuing education department. And during these challenging times, we are proud to be offering a series of presentations that are free, focusing on personal development. And so we've had 2 already on time management and stress management. And this is our last in kind of a series of body-oriented or mind-oriented presentations. And then our next 3 presentations will be on finances, followed by 3 presentations on getting and obtaining a job. Without any further ado, I'd like to introduce to you our presenter today, Ms. Jessie Jones. Ms. Jones has over 25 years of experience working with families and individuals with unique challenges and special needs, and she's done this in both New Jersey and Georgia. She currently is the public benefits specialist at Savannah Technical College, but joined the college over 7 years ago and has served in numerous roles. She has a bachelor's degree of science in social psychology, and is just one of the most amazing and caring people you'd ever meet. We're proud to offer you this presentation, Eat Better, Live Healthy, Learn More. Ms. Jones, please turn on your mic and begin to share with us. And let me make one housekeeping. I apologize. One housekeeping is I'm going to randomly put some polls up here, so feel free. We have a small group today. That's okay. We're glad that you can join us. I will be putting a poll out. Polls will be going out randomly, and make sure you can interact with those. Ms. Jones?
Thank you so much. Thank you, Dr. Stubbs, for that introduction. So as he said, my name is Jessie Jones, and I am the Public Benefits Specialist at Savannah Tech. So today we're going to talk first. I'm sorry, let me back up. Just wanted to give you just a background about the topic, Eat Healthy, Live Better, Learn More. As a public benefits specialist, most of the input that I get or the services that are applied for are SNAP. And to be quite honest with you, I know a lot of you have probably seen the SNAP logo, and it's that bag with the vegetables and the bread, and I don't like the logo. It has a nice concept, but eating healthy consists of a lot more than just fruits and vegetables. So my supervisor and I had a discussion, and we came up with a slogan to help build a program around SNAP and the other public benefits that people can apply for that we could also use as an education tool, which is what we're doing right now. So Eat Healthy, Live Better, Learn More was actually created on the premise that if your body is healthier, your brain functions better. And if your brain is functioning better, then your life becomes more manageable even when it's not, if that makes sense. So before I start, I just want to throw in a disclaimer because I'm not an expert on this topic. I'm not a nutritionist, I'm not a doctor, I don't have a medical background. So what I'm bringing to you today is based on things that I've read and researched and my own personal experience. So there are three things that we're going to discuss today. We're going to discuss the effects of unhealthy eating. And we've all heard about effects that unhealthy eating can bring. So right now we're just going to do a little interactive thing and discuss the kinds of things that you've heard about, the unhealthy eating habits that affect your body. So anybody can chime right in and just, let us know what you know about unhealthy eating and the kinds of things that unhealthy eating does to your body. There's also a poll up, and we're just asking you whether or not you think it's easy to eat healthy. And you can just click on one of those, and Dr. Stubbs will give us the responses. Okay, and then anyone that wants to chime in of what you may know about what unhealthy eating does to your body, please feel free. Okay, so for now, we'll just move on. But not only will we talk about effects of unhealthy eating, but we're also going to talk about smart choices for a healthier diet. And then we're going to talk about the public benefits connection in all of this, as I explained a little bit earlier. And then we'll just wrap it up. So, two things we're not going to discuss, and that's dieting and meal plans. And I don't know about you all, but I've tried the diets, I've tried the meal plans. Um, I have meal plans and dieting in my computer that I've been searched, and I am just like up to my eyeballs with dieting and meal plans. So, as I said before, the goal at this time is just to discuss some healthy eating habits and some reasons why it's we need to think about healthy eating. So, compelling reasons to change our diets, and I found these, especially in this time, um, very interesting, but also a good reason to start thinking about changing our diet. So, some compelling reasons for changing our diet, and this is one of them. Overall, eating healthier can not only reduce stress, but it also can help your immune system fight off illnesses and diseases. Okay. And the next one I found very interesting. I found this in a New York Times article, and to me, this is one of the most compelling reasons to begin starting to eat healthy, not for just for ourselves, but for those that we care for, and even to try and convince others that they need to think about changing some things in their diet. And I'm just going to read it. According to Dr. Darish Mozaffar, and I think I'm saying that right, Dean of the Friedman School of Nutrition, Science, and Policy at Tufts University, one of the main causes of death through COVID-19 is an overwhelming inflammatory response that disables the body's ability to fight off pathogens, that causes it to become neutrally compromised and more vulnerable. So one of the things that happens with unhealthy eating is that the kinds of things we eat, they cause our bodies to become inflamed. And as a lot of us will feel bloated. We feel full all the time. And I know that I was in that category because before I started trying to practice some healthy eating, I was always bloated and didn't know why, and never got hungry because I ate all the time, and the kinds of food that I ate kept me in that bloated, inflammatory stage, so I was never hungry. So, what can we do to begin to eat healthy? And we have a poll here. Some of the things that I was saying about bloated. I was tired all the time. Didn't get in any exercise because I was so tired all the time that I really did not even feel like doing that. And we've all heard that saying, a body in motion stays in motion, but a body at rest stays at rest. And it's true. I'm a witness that once I did get up and start moving, I felt like moving more. So there's a poll here, and it looks like the biggest response is tiredness, and it is very true. Even with the unhealthy eating, one of the things that we also need to do is we need to start moving. And everything in its own time, gradually until it increases. I started walking 2 or 3 blocks, increased it, and am not only feeling better, but find that I can do more throughout the day than I could before. So, how do we start on this road? And everybody's path is different. We're not all going to go the same way. We don't. There's no pattern that says this is how you have to do it. We all do it differently. We are always told about meal plans, dieting, that I said we're not going to talk about, and we're not. But a lot of times we get so hung up on the dieting and the meal plans, and we start doing something and we expect immediate results from it. And when that does not happen, then I know for one, I would become disappointed, discouraged, and would go back to my old habits. And that's why I say that we have to find our own pattern, create our healthy habits, not create restrictions, move gradually into becoming more healthy. And here's another poll. Have you been discouraged by a diet that would not go well? I've been discouraged quite a few times. Like I said, I just got up to my eyeballs with plans that didn't work, diets that didn't work, start them for a while, stop. And then when I went off the diet, ate something I wasn't supposed to eat, I became discouraged. I just immediately quit. I can't do this. But not too long ago, I heard of something or read something somewhere that said instead of meal planning and instead of dieting, buy healthy foods that you like and plan your meals around the food that you like. And that really struck a chord with me because I don't, I can't do diets, I can't do meal plans. But just not too long after I read that, probably near the beginning of April, my refrigerator broke. So everything I had in the refrigerator, I had to throw out. So for me, this was the perfect opportunity to try to buy healthy food instead of a meal plan and dieting, and then plan my food around what I like. Buy the things that I like that I know are healthy and nutrition, and plan around those instead of buying food that a diet or a meal plan said that I should buy. So as I said, after my refrigerator went on the and everything had to go out. So I started buying healthier food. I changed my shopping habits. I bought what I knew was healthier, and I started planning my meals around that. I could look in the refrigerator and decide, okay, I'm going to do fish and vegetables today, and the fish and vegetables are right there, and I know it's healthy. So instead of the meal plan, I just started eating things that I knew were healthy, and that works for me. But I know that we all have different lives, we have different busyness, we have different things that we have to do, we have different responsibilities. And that's why I say you have to create your own path. You have to decide what's healthy for you. Oops. Okay. So these are just some suggestions on ways you can start doing that, some goal setting suggestions. Um, and like I said, everything in moderation and gradually. And I think that's one of the keys is to start doing it gradually. So one of the things that was suggested was cutting back on some foods. I used to eat pizza a lot, and I would buy these frozen pizzas and I would put them in the refrigerator. And then you have to bake the whole thing. So I would put it on the stove and I would slice probably 2 slices. And then before you know it, I'm back and I'm slicing some more. And by the time the evening ended, I would have eaten that whole 8-inch or 12-inch pizza. I still buy pizza. I still buy the frozen pizza. But once I cook it, I automatically set it aside and I cut it into pieces, appropriate portion sizes, and then I just wrap them up as soon as they cool and I throw them in the freezer, except the one that I'm going to eat. So now I swap out all of that pizza and I'll eat a healthy dinner, even though I'm eating 1 or 2 slices of pizza. So we have a poll. What have you tried? Cutting back on some foods, adding healthier foods, cutting out other foods, make changes as needed. And it looks like most of us are cutting back on some foods. Some are adding healthier foods, some are cutting out other foods altogether. So, and as I said before, make the changes gradual because it's my opinion that if you try to do everything at once, it's not going to work. For me, I just started switching out different foods that I knew were healthier than some of the things that I was eating. Um, and doing that, I no longer feel that pressure or that guilt that I used to feel, even when I go back to some of the things that I eat that I know aren't quite as healthy for me. Um, if I want ice cream, like that's the other thing too. If you're craving something, eat even if it's just a little bit. Eat some of it because that craving can be what will get you back to your old habits. I love ice cream. As a matter of fact, I just bought a pint. And I used to sit and eat a whole pint of ice cream in one setting. And what I would do to help alleviate my guilt is I would get a little bowl and I'd put some in the bowl and then I would I'd eat that. And then about 20 minutes later, I'd go get another little bowl and I'd eat that. And before I know it, before the evening was done, that's right, the ice cream was gone, the whole pint. So we shouldn't, and I know you've probably heard this before, we shouldn't deprive ourselves, but we should start being careful about the kinds of things that we do eat. Okay, and then we cut out other foods, replace those for others, and make changes as needed. There's always room for making changes. Okay, and make gradual changes. Choose mindfully. Read labels. Um, I've started reading labels, and has everyone ever read the label on steamed vegetables? Not all of them are just vegetables. I found that out because I buy steamed vegetables and I picked one up one day and said, let me just look at the back. And I looked at the back and some of them say vegetables. For instance, if you buy carrots, it says carrots. But I also found that there are a lot of additives in some of those steamed vegetables. So read your labels, watch your calories, eat reasonable portions, as much as you can, cook and eat at home. I know that's not always possible. And look for the heart check mark. That's always helpful. And these are just some helpful resources. USDA, the United States Department of Agriculture, has a lot of information on their site. Choose My Plate is one of their sites that they have, and they also have other resources. And there are also farm markets that will allow SNAP users to buy food and get a discount. So it's a 50% discount. So if you buy $20 worth of food, you could end up with $40 worth of food. And the nice thing about My Plate is that they also have resources for children. They have activities sheets, they have videos and songs. So if you do have children, try to get them involved in the healthy eating process as well. And then there are apps and tools that can help you maintain your healthy eating, fitness, um, and these are some of them: Fitbit Coach, Samsung Health, MyFitnessPal, Runkeeper, Headspace, FitPlan, 8Fit. These are just a few. There are a lot more out there. I personally use Samsung Health, and it has helped me quite a bit. Okay, finally, just briefly, we're to get to the crust of what I actually do as public benefits specialist. So, through a partnership with Step Up Savannah, I can help you determine whether or not you're eligible for any of the federally sponsored programs offered by the Division of Children and Family Services. And those are the Supplemental Nutrition Assistance Program, which we all know as food stamps or SNAP, Peach Care for Kids, Child Care and Parent Services, and the acronym for that we use a lot is CAPS, and Medicaid. One of the other things I wanted to point out is that as the public benefits specialist, when you're applying for these programs, which is something that I'm able to do for you, right now DFACS is only doing telephone applications, but I can work with you to get that done as well. One of the advantages of working with the community partners in order to fill out your application and get things done, and even if you don't, one of the advantages is that we can help you with issues that you may be having with public benefits. So we are able to contact a state supervisor and give them only the information that they allow us to do over a confidential email line. And what we can do is we can email them, tell them what your issues are, and they in turn can contact the person that they need to contact, find out what the issues are, get information, email us back, and we can relay that information to you. And it's usually a speedier process. Of course, now as they may have a lot of cases, it may take a little longer, but it's still a speedy process that we can help you with. And we are allowed to do applications not just for students, but we can also do applications for the general public. Okay, so some of these programs, as I said before, CAPS, supports early childhood goals by assisting qualified families with childcare costs while they work, attend school or training, or other work-related activities. And this also includes the after-school programs for children of certain ages. One of the other things that I wanted to point out is that I'm only going through these briefly because there are so many different programs and so many different requirements, so many different eligibility requirements. So we help you fill out the application, but ultimately DFAS is the one that determines whether or not you're eligible for any of their programs. Medicaid is the healthcare program, and there are quite a few Medicaid and healthcare programs for different situations, for different reasons, and these are just a few that I put on here. Health insurance premium payment program. That's a program that can help you if you are working and your employer does not give you an insurance benefit, or if that benefit is so expensive that you cannot pay for it. Medicaid may be able to help you with that. They may be able to offer you a supplement, and you only have to pay a small premium. So that's one of the Medicaid benefits. One of the others is autism spectrum disorder. And then there's also the Georgia Families, which is a program that delivers healthcare services for Medicaid recipients. And it also, Peach Care for Kids falls under that umbrella as well. And then finally, the one that I work with the most, and the one that most of us are most familiar with, and there's that little logo that I was talking about with the bag and the fruit and the eggs and things, that is a representative of healthy food, but does not encompass everything that's healthy. SNAP is ensuring access to nutritious food while helping to pave a pathway to long-term success. Success not only in healthy eating, but success in all those things that you want to do to be better, to be more successful. And it's also ending hunger and moving people towards self-sufficiency. Also, this is another thing that I do, and this is probably one of the things that I really enjoy, is that as a member of the Working Family Network, it consists of different social service agencies, United Way, Step Up, and community providers, nonprofits, and for-profit organizations. And our goal is to help others become successful. And the nice thing about this is that all of these networks work together. We receive information from all of these resources, but the nice thing about it is that we can email them. If we have a student, community person that needs a service other than the services that we actually provide, we can email them and ask them, is there anybody out there that knows of anyone that can provide this service? And what they'll do, because we're not allowed to use names, so we just say we have this person, this is what they need. Does anyone out there have any resources? And does anyone out there have any information? And what they'll do is they'll email us back and they'll say yes, have them contact this person or that person, or the person that can provide the service or the resource will email me back and they'll say, yes, I can do this. Can I contact the person? Then I, in turn, will email the person that needs resources and will ask them whether or not it's okay to give that person their contact information. So we maintain confidentiality in every one of these situations. And then we also have a great student support resource library that's for our students, but it's also accessible to anyone in the community, anyone that needs these resources can actually look on this page. And there are so many links that are available that can help you. And if you have questions or you need further access or further resources, you can always contact us. So, if you don't get anything else from this, just remember to create healthy habits and not restrictions. It's the restrictions most of the time that causes us to not maintain that healthy goal. And that's it. Thank you so much for being a part of this. And like I said, if you believe that you need resource, you can always contact me. My name and number. My office number is here, but this is also my temporary COVID-19 number because I'm not always in the office. This is my email address. You can also reach me at snap@savannatech.edu. Thank you so much for being here, and you have a wonderful day and stay safe.
Ms. Jones, thank you so much on behalf of the entire college for your presentation today. Anyone on the call have any questions? If not, this concludes our session today. We hope to see you in future sessions.